Our infectious disease is cholera. It was done by Serene, Jaden, Sarah, Natalie, and Mia. Our topics that we'll be going over today is a causative agent, which will include the scientific name, the type, and the classification. Then transmission epidemiology, which will be on how it spreads, its prevalence in populations, and what it affects. Then we'll be going over pathogenesis and symptoms, which will be on how it causes the disease and common clinical signs. Then diagnosis and treatment with prevention, so diagnosis methods, available treatments, and prevention strategies. Then we'll be going over microbiology connection, which will include staining techniques, morphology, and virulence factors. Then human connections, and that will be on how it affects patients or families. Then references, which will just be our works cited and our sources. So first, our causative agents. So our scientific name is Vibrio Cholerae. Our type is bacterium. So cholera is a deadly infection caused by the bacteria Vibrio Cholerae. This bacteria can be aerobic or a facultative anaerobic. It'll contain a single polar flagellum, making it highly motile. The bacterium causes a highly contagious diarrheal disease. It concentrates in the small intestine where it makes and releases a toxin that leads to diarrhea and a rapid loss of fluids and salts. It's stated, every year an estimated 1.3 to 4 million people around the world get cholera, and between 21,000 to 143,000 people will die.
Transmission and epidemiology. As we heard before, cholera is a disease caused by the bacterium Vibrio cholerae. This bacterium lives in aquatic environments and is transmitted through the fecal-oral route. This means that it is spread when the pathogen of an infected person's feces passes into another person's mouth. This can happen through direct contact, such as by touching a contaminated surface and then touching the mouth, or through contaminated food or water. Although cholera is highly contagious, it does not spread from person to person or casual contact with an infected person. In developing countries, poor water quality and sanitation are common. This causes an ideal environment for bacteria to grow. Humans are the only natural host for Vibrio cholerae. Travelers to areas where cholera is endemic or where an active epidemic is occurring are at risk for cholera infection. Healthcare and response workers, people without access to safe water or food, people who have inadequate gastric acidity, and people with O blood type are also at risk. Cholera is prevalent in a few countries, including Pakistan, India, Kenya, Haiti, and Dominican Republic. Cholera has had 7 pandemics. The last pandemic began in 1961 and still continues to present day. According to NIH, National Institutes of Health, cholera appears to exhibit 3 major epidemiological patterns: heavy endemic, neo-epidemic, and developed countries with good sanitation.
Pathogenesis and symptoms, how it causes diseases and common clinical signs. Pathogenesis. After entering the body, usually through contaminated water or food, Vibrio cholerae travels to the small intestine. There, the bacteria attach to the intestinal lining and release a toxin called cholera toxin. This toxin forces the cells in the intestine to pump out massive amounts of water and electrolytes. Because of this, the body loses fluids extremely fast, leading to severe watery diarrhea. The symptoms for this disease are profuse watery diarrhea, often called rice water stool, vomiting, rapid dehydration, dry mouth, and extreme thirst, low blood pressure, muscle cramps from electrolyte loss, and in severe cases, dehydration can lead to shock and death if untreated.
Diagnosis and prevention. The diagnosis are rapid tests, rapid assessments for epidemics, stool tests, cultivates the bacteria to verify infection, and the microscope is used for confirmation. The prevention for this disease would be clean water or sanitation, heat or treat drinking water with chlorine, and vaccines. Cholera vaccines given orally in areas with high risk. Prevention. If you are planning on traveling, it is always good to make sure that you're washing your hands with soap and clean water. Drink clean water and also get the cholera vaccine. The treatment. Zinc supplements. Assist kids in healing more quickly. Rehydration. Consume oral rehydration solution or receive fluids if extremely dehydrated. Antibiotics. Exclusively for critical situations to reduce duration of illness. And lastly, testing. Isolate Vibrio Cholera from a stool specimen and perform O1 and O139 stereotyping.
Microbiology connection, staining techniques, morphology, and virulence factors. Gram-negative bacteria and is also comma-shaped. Gram-negative will have a pink color stain, thin peptidoglycan layer with an outer membrane rich in lipopolysaccharides. The virulence factors is cholera toxin, TCP, accessory colonization factors that enable intestinal colonization and severe watery diarrhea. Human connection and the effects on patients or families.
Next, we will show a video that shows the effects that cholera has had on a community in South Africa. This community has gotten together to build a clinic and help the families in need who suffer from cholera.
What we've noticed with cholera outbreak is that it's not a disease that you can say you can take it lightly, because it has left other families parentless.
On the third day, that is where our principal started to say, we need some intervention, we need to establish the cholera center.
Because the field hospital was set up within the community, it helped us a lot because it was closest to the community. It relieved us of the pressure of everybody influxing to the hospital.
The response that we're doing is to do active case funding in the community, to educate the community, and also to make sure that everything else, the water that they're drinking, they are fine.
The World Health Organization was here on the ground together with the Department of Health in South Africa, so that they must help our country and our people to be aware of this disease, because this disease was very terrible.
This video is a good reminder that cholera is not just a disease that is caused by a bacterium, but it's also a disease that affects people, families, and communities. These are our references.
Thank you.